you. Okay, our first question comes from April Lawrence, Check News.
Hi, Dr. Henry. About 10 days ago, you were asked about the program in Langford where they're doing in-home COVID-19 testing. They've since expanded that program, and I'm just wondering if your feelings about it have changed at all since then.
No, they haven't changed. My concern is that it's not a good use of resources for testing people who are at low risk, and we're focusing on where we need to understand where people are infected. Where I do think this program could be extremely helpful is in providing support to people who have traveled, people who have mild illness, to help them isolate appropriately at home, to provide them with a healthcare provider who can answer their questions and their concerns should they start to get worse, and can provide them advice about treatment, about whether they need to access hospital care. So that would be my advice to them, but I'm concerned that it is a diversion of resources unnecessarily.
Next question is from Moira Witten from the Tyee.
Hi, good afternoon, Dr. Henry. We've had sources tell us of a case in the downtown East Side building. Would you ever announce this publicly if it were confirmed? You've announced similar cases in seniors' homes and other vulnerable areas, and this would affect a vulnerable population.
So no, we would not identify an individual case unless it was related to an outbreak. So we do have protocols that we use all the time around outbreaks, and for example, today, the community outbreak that we announced because it is in the public interest to understand what's happening there, and the investigation is ongoing. We also have a very detailed protocol for announcing outbreaks in facilities, and we have a very low threshold, as I mentioned, particularly for long-term care. So yes, on occasion, if there are cases and transmission in a shelter, for example, that is ongoing and being investigated, that might be announced. But an individual case that's managed where there's no risk to the general population would not necessarily be.
Joe Fries, Penticton Herald.
Thank you, Dr. Henry. Following up on that last question, you've been asked many times why you're not identifying communities in which COVID-19 patients are located, and I can recite from memory your answers, those being privacy reasons, you don't want to discourage people from coming forward, et cetera, et cetera. Now, you've also said all of your decisions are based on the best available evidence. So can you tell me on which evidence this non-disclosure policy is based? And if I may, Minister Dix, the governments of Alberta, Ontario, and Quebec all report cases at the community level. Will you reconsider this policy? Thank you.
Yeah. So this is not a non-disclosure policy. This is how we do business in terms of public health. When there is a risk to the public that we cannot identify individuals who might be exposed to somebody with a disease, and in this case we're talking about COVID-19, we put that out publicly. And there's been quite a bit of that recently, where people have been in certain premises, they've been in a public space where there might be other people at risk, and we can't identify them individually. We put that out in the public domain. That's how we have always done this. I think the challenge right now is that these things have evolved over time. And initially, of course, we had very small numbers of people who were coming in from other countries. And it became incredibly important to make sure that they were not individually identifiable. Because with this disease, as with many communicable diseases, there is still very much a stigma associated with it. So this is a practice that we are all using across the country. It's consistent in how we're applying the approach. Quebec, for example, is talking about communities where they have transmission in that community and they've put in place measures. We're talking about outbreaks that are happening in public or in facilities. Those are things that are consistent with our approach from public health perspective. So it's not a non-disclosure policy in any way. It's about how we best able to support people. And I think the other thing in the transition that we are seeing is that we now have community spread. spread, and we don't have the ability to know everybody in our environment who has this disease. So the measures that we have been directing people to take across the province around physical distancing, around not gathering, around not having people together in clusters in our homes, in our churches, in other public settings, about closing restaurants, this is because we all need to put space between us to stop the transmission of this virus from those unknown cases. And that is in every community, and it is even incredibly important in small communities where we don't yet have any tested cases, for example. So this is not something that is about protecting people's privacy necessarily, although that is obviously an important consideration. It's about risk to the public and understanding where that risk is and the measures that we all need to take right now in our communities across the province.
Nothing to add to anything Dr. Henry said, just the question I think you asked me. I think one of the things about British Columbia and the way we've managed this that is very valuable, and I'm not going to talk about any other provinces, people can see that in other jurisdictions, is that we've had a provincial approach from the beginning. Dr. Henry and Steve Brown are the head of a structure that involves all of the health authorities, all the regional health authorities, the provincial health authorities, and the First Nations health authorities. That's our view of things, whereas in other jurisdictions, I think it's fair to say that health is somewhat more decentralized among more units. So we have, I think, gone on this path from the beginning of managing this provincially. And I think there's been huge advantages in doing that from the beginning, and there'll continue to be advantages as we go forward.
Okay, next question comes from Tanya Fletcher, CBC.
Yeah, I'm wondering if you could clarify, Dr. Henry, can you give us a bit of a timeline more specifically for the West Kelowna nursery outbreak? Can you confirm which date the workers at Bylands Nursery started to isolate themselves?
So these are, I have to be very clear, these are farm workers who came in on the temporary farm worker program prior to there being restrictions on people coming into the country in early March. So they were here on that program. Some people were identified as being ill and were tested, I believe it was, I don't even know what the date is today, to be honest. It was on the weekend, and they were investigated by public health, who went into the premise over the weekend and understood where everybody was living. We did they did an investigation of the entire public health follow-up of all of the people who had been in the premise and where they were working and who. It's part of the work that we do in public health. Every case investigation, finding out who was in contact with whom. These people were being isolated in that they weren't going out into the community because they had come in from another country, but there was some considerable mixing on the farm when they were working together. So we now know that there's a group of them that are in accommodations, and the accommodations are satisfactory according to the MHO and Interior Health, that they're able to isolate people who are sick and care for them there. We have, they've gone in and done a questionnaire in the language of choice for the group who are there, and identified anybody who's had symptoms, and those people have been tested, and anybody who is symptomatic has been isolated. So it's, it is a community outbreak that was caught relatively early, we hope, but we will see over the next coming 2 weeks. There are people right now who are not sick, who have been exposed to some of those people who are, and they have a probability of becoming ill over the next 2 weeks. So we'll be monitoring that very carefully, and it will be 2 to 4 weeks before we understand the extent of this outbreak.
Next up is Shelby Tom, Global Okanagan.
Thank you. Just following up on that, Dr. Henry, you mentioned the outbreak at the West Kelowna agricultural property. These workers are exempt from some international travel restrictions. They do usually reside on the farm together in close quarters. Is this something that you're concerned about the potential for more outbreaks among this demographic? And what more can or should be done to prevent outbreaks among temporary foreign workers?
Yes, this is something I am very concerned about and have expressed that concern. We've had these discussions at the national level. As you know, this is a national program. BC is one of the provinces that benefits from the temporary foreign worker program on an ongoing basis, and it's a very critical part of supporting a number of different farm industry, agricultural industries across the province. But there are other provinces who have the same concerns, and many of the people come in from countries in South America or Latin America into BC and other provinces. So we have been talking about it nationally, and certainly some people have come in several months ago and they are past the risk stage, and it's becoming more challenging for foreign workers to get in because many of the flights from places that we would normally accept foreign farm workers are not able to leave at the moment. But we are in ongoing discussions with our counterparts across the country and with the federal government about the need for having effective quarantine for individuals who are coming in from outside the country. And in my opinion, that needs to be in a facility that is able to effectively support and care for these people. We're very lucky that this group has very good accommodations where we're able to isolate people effectively, but we know that's not the case in all places where temporary farm workers are housed. So that is very much a concern that we're bringing up with our federal counterparts.
Vaughn Palmer.
Minister Dix, last week you told the legislature that at the earliest you thought these orders and rules would be in place at least till the end of April. Hearing reports and briefings out of other provinces now that more likely we are looking at end of May, end of June. Do you think that it's more realistic to think that we'll be living with this and these rules and physical distancing and all that for at least another 3 months?
I'll start because this is something that obviously we've been thinking a lot about, and the days that we started to implement the orders and the controls that we've put in place, we started to think about what would it take for us to go back a little bit, a lot, a little bit in some areas, more in others. What would it look like for us to try and get back to some of the activities that we have? Realistically, and I've said this before, we are going to be in some form of having to monitor and prevent transmission of this virus until we have a vaccine, or until enough of the population is immune to it that it's no longer infecting people. But we know that that's a very high number. So a vaccine is something that we need to really, really push for. We are likely in our first wave right now, and we've watching what's happening in Wuhan, for example, when movement is starting again, restrictions are being lifted. And we have to go back to a different way of thinking. So when we get through this wave, which will likely be in another few weeks, it may be into May for sure, we need to start thinking about what does it look like again to understand if we're starting to see importations again, if we're starting to see clusters and cases being transmitted in the community. So we'll be going back to, likely, a very similar scenario to what we were about 6 weeks ago, when we were doing very active public health follow-up of anybody in the community again. We'll be doing testing on a different strategy again when we're in that place. So those are the things that we want to think about, but I do think it's more and more less likely that we're going to be able to get back to full normal life, which I miss a lot, before at least the summer. And then we need to start preparing ourselves for the potential of a second wave in the fall. In the meantime, we need to put every possible effort into development of a vaccine.
I think what I said a week ago was there was zero chance, none, that any of the orders would be varied by the end of April, and that's apparent that that's the case. What it looks like in May or June or July is harder to say, and a lot of it depends on whether people are committed, as I believe they are, and I think we've seen that, to responding with a 100% effort to bend the curve. But this is going to be a challenge for a long time. I think I've consistently said weeks, days, and weeks, and months, and I think that's true. But I would say it's still zero chance before the end of April. And I think in terms of any of the orders being suggested, a similar kind of chance, little to none, in May or in the immediate weeks after that, after May. I think we're into this for a long time. And the challenge, and I think Dr. Henry's talked about this, the challenge of what would happen after that. And we'll be happy to meet that challenge if we are able to address this well or better than as best as possible over the next few weeks. That will be a major challenge to face as well. How one moves from where we are now to the next phase is going to require a lot of work, a lot of thinking, and a huge challenge. But for right now, we need people to be 100% committed, all in, and it's going to take a while, and people are going to have to be patient. We're not even in April yet, although we're in April tomorrow, and these next couple of weeks, as Dr. Henry has suggested, are some of the most important weeks so far. Will be incredibly important to see what happens in the next couple of weeks, and we've all got to be fully committed. I know that everybody working in healthcare is fully committed, but as for the future, still zero chance for the end of April. The chances after that are challenging as well.
Next question comes from Victor Kaiser, Radio NL. Go ahead.
Victor has removed from queue.
Oh, thank you.
I haven't given up entirely the hope that we might get a reprieve during the summer, as we do with influenza and some of the other respiratory viruses, although how much of a reprieve is yet to be seen, and I've been watching Australia and New Zealand very closely to see what's happening there and the transitions there.
Okay, so we're moving on to Sandy Hall from CFAX.
Yes, hi. I'm asking a question today about the varying numbers of crowd sizes that have been applied across provinces in Canada. We're getting questions about it. Why is it 5 in Ontario and 50 here? And are we looking at reducing the sizes, given that people keep breaking that?
Yeah, so we also had that discussion on our Special Advisory Committee call on Sunday across the country. And, you know, it really is about... right now, all gatherings are off the table. We're all in that place where any time we get together with more than our household members or our families, we're putting ourselves at risk. And particularly if we're going to be in contact with people who are older and more likely to have severe illness. So when I talk about 50, that's for mass gatherings, for events, for things that are happening in the community. And I am reticent to go, none of these are based on scientific evidence. There's some evidence in that some modeling that Alberta has done that shows that 18, if you have less than 18, your probability of having a case may be less, and so they went with 15. But the bottom line is, none of this really is based on science. It's based on our best effort to ensure that we're not having events like large conferences or groups or church meetings. We know as well with this virus, from what we've learned, is that it is those indoor intimate meetings that we know this is more likely to be transmitted. And a case in point recently was in Newfoundland, where they've had 2 quite large funerals and now have over 100 people who have been affected related to those events. And we've talked from the very beginning that those are risky settings where we're inside together with groups of people where you can't maintain that distance, and particularly for events like church meetings, like funerals, like weddings, where we're sharing food together and we're having interacting with each other and hugging, and those important things that are so much a part of our lives. Right now, those are very dangerous. So there is no number that is okay or safe right now. I'm not going to change the order just because we know that people interpret it in a variety of different ways, and it's challenging for our homeless people, for example, where they may need to be in a setting together, and it can be a focus for people persecuting people who have no place else to go. So there's a whole lot of thinking that goes into it, not a lot of science, but right now, across the province, any gathering, particularly any gathering indoors that's not your close family, your household members, is a danger, and none of them should be happening right now.
Keith Baldry, go ahead, please.
Hi, Dr. Henry. I'm just wondering, the 5 deaths overnight, or the last reported 5 deaths, am I correct to assume that they are all elderly or members of care homes?
Yes, most of them are members of care homes. All of the deaths have been in people, there's only been a single death in somebody who is in their 60s. The rest are all 70s, 80s, 90s, and that reflects that the vast majority of them have been in our long-term care outbreaks, unfortunately.
Next question, Melanie Nagy, CTV.
Just wanted to go back to the situation with the downtown east side. We're hearing from a lot of advocates that they are struggling to maintain physical distancing on crowded streets. They also say that they're grateful for city, provincial, and federal resources, but then they're not coming fast enough, and they really do feel extremely vulnerable and in a desperate situation there. Anything you can say to them, or any other measures that are going to be put in place to help, particularly when it's so hard to physical distance on the streets?
It's an incredibly challenging situation, as you articulate, and I know Vancouver Coastal has been working with the many agencies there. We have contingency plans to support people if they need to be isolated or quarantined because they've been in contact with somebody who has this, as ways to try and prevent transmission in that community. But we know that this is a crisis that is on top of the crises that we're already facing around the overdoses and the deaths that we're seeing in that community and in other communities around the province. So we are doing the best that we can do. I think we need to have a rational approach to some of the measures that we have that support people in that community, and I know there's a lot of concern around things like the food banks and people lining up, and there might be a long lineup to access the food banks, and how do we do that in a way that still allows people to get the essentials that they need to live. So I have no easy answer, and I know that there's a lot of energy and time, and we're working very closely with the many organizations to try and make that work.
Marcella Bernardo, News 1130.
Hi there. I just wanted to ask about the situation that we're in right now as far as the new normal goes. If you could be more clear about what is it that you're saying, that until we have a vaccine, we may be under these restrictions for weeks, if not months?
I don't believe that we will have all of these restrictions for that period of time. What I do know is that this is a critical part of our first wave. And we've seen that, the infectious disease outbreaks do come in waves. They don't just continually, there's many different factors, but part of it is how we respond to them. And we've seen in other countries that we do reach a peak and we start to see things coming down. We've seen that in China. We're seeing it hopefully now in parts of Europe as well. So we need to hold the course right now. It's incredibly important that all of these distancing measures that we're doing to build those firewalls in our community and allow us to find those outbreaks in the community, to make sure that people who are sick enough are able to get the hospital care and the critical care that they need. That's where we are right now. I don't think we need to be this locked down, if you will, for many, many months. As we said, the next few weeks are really, really critical. And then we need to think about how to do that in a thoughtful way that allows us to get back into some of the critical things that we need in our lives to be part of our our community to support each other. But I do think it's really important that some of the things that we're doing now are going to be needed for a time, and being comfortable in how we can support each other virtually, how we can continue and maintain those social interactions virtually without the downside impacts that we know that this type of isolation can lead to. So right now's our time to try and come together to support each other, if not physically, but at least to do that socially and virtually.
So we have time for one more question, and just as a reminder to any reporters that didn't get to ask a question today, there will be a statement released later this afternoon with all the information covered in today's press conference. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, please visit gov.bc.ca/COVID-19, and for a full listing of the provincial health officer orders, visit gov.bc.ca/PHO guidance. Our last question is from Richard Zussman with Global News. Go ahead.
Dr. Henry, why does the province's count only seniors care home include publicly owned and operated facilities rather than all care home facilities? And is there any sense of how many other outbreaks, by your definition, there could be in those other care homes?
It's all care homes that are included. The Lynn Valley, for example, is a privately owned care home, so there's no restrictions. It's all facilities.
It's all facilities, Richard. All the facilities that are described as care homes are still regulated under the Community Care and Assisted Living Act, and Lynn Valley has public people, but it's a private care home. But if there was an entirely private one, in other words, there were no public beds in it, and the Community Care and Assisted Living Act applied, you'd be hearing about that here. There are other facilities that are not under that act, which you might describe as independent living, that wouldn't be described in the same way, but if there was an outbreak that was declared, we'd be describing it as well.
Okay, I think that's all the time we have for today. Thank you, everyone.
Thank you.